collimator, but thanks to Rizwan, we have been able to use iris collimator. It enhances the treatment, it increases the number of patients that you can treat every day. For instance, Karachi can treat about 8 patients a day. We can treat 8 patients in half a day. So wonderful achievement here. These are other machines that do the same thing, but as I was saying, they are very rigid. They can't move so flexibly. The nearest to it is Varian True Beam, but still it only moves like a full arm, not like our machine which can move in multiple angles. So compared to other machines, we have a lot more flexibility and accuracy just because of its design and nature. So it's a compact linac, which we were saying where the photon beams come out. It's attached to a robot, which causes it to guide the tumor, the beams onto the tumor target. And it uses high frequency microwaves. Because it's using high frequency, the whole linac is compact and smaller in size. And image guidance system that I talked about makes it easier to track the tumor during the treatment. And there are pencil beams. These are very, very tiny, small pencil beams like this laser. These are hundreds of beams that go into the patient and treat accordingly. But what happens is, because you are so thin, make sure you're not missing the target. So every couple of beams, the machine stops, takes an image, tracks, makes sure the tumor is within the target, and then adjusts its alignment accordingly and restart the treatment within a couple of seconds, right? And it also is designed for taking images, as I said, and we can see them realistically in real time, and I'll show you the examples later on. So millimeter is accuracy. There is no frame. Stereotactic frame is required, which we used to do for gamma knife. Dr. Habib would know that we have to drill the holes and make the kind of a fixed frame for the patient so that head doesn't move. Here we don't need that. Treats all parts of the body, not only brain, but various parts, pancreas, liver, prostate, and other areas. It can treat multiple places at the same time. So if you have 8 or 10 metastases, in future, inshallah, we will be able to treat all those metastases at the same time, rather than treating a very wide area, only those metastatic lesions, and I'll show you the example later as well. Its treatment is completed in days. So instead of 6 to 8 weeks of treatment, this can be done in 1 to 5 days. Very good quality of life for patients, especially patients who are coming from a distance. A lot of our patients are coming from KPK. For them to stay for 6 to 8 weeks is not possible. This machine makes the treatment within a week, and they are able to go back home. We can also treat the previously treated areas. Because our margin is very, very small, the previously treated areas can be treated. The radiotherapy, you can give as much as to the tumor, but it's the areas around it that makes you wonder how much treatment can you give. For instance, in prostate, bladder and rectum are very close to each other, close to your target. You have to make sure you don't exceed their tolerance. This machine helps us do that. So if you have treated prostate previously and now there is a small lesion in the prostate, you can do an MRI and just treat that lesion rather than the whole prostate without exceeding the tolerance of bladder or rectum. So these are the indications. We are currently doing all intracranial radiosurgeries. We have done few AVMs as well. Extracranially, we have done spine, we have done prostate, we have done bony metastasis, and we have currently started with prostate program, and inshallah move on to liver and lung later on. The benefits, as I said, fewer fractions, fewer days of treatment, We can treat closer to the critical organs, and there's no anesthesia required, there's no infection risk, and the treatment finishes quickly. So it just shows that if you want to treat the front of your hand, you can literally avoid the back of your hand. Not zero dose, but very, very little, smaller amount of dose. So this is how accurate and how good this machine is. Millimeter margins of treatment. This is our treatment planning system. When the patient comes up, we do the CT scan, we contour what our target is, which you can see here. This machine makes us fuse the images. It has an artificial intelligence program where it contours the normal structures itself, and we adjust the contours accordingly. It can also tell us our workflow management, and it's optimized for both extracranial and intracranial stereotactic radiosurgery. So what is our treatment protocol? The patient comes to the hospital, we look at the images, all three of us, Dr. Aisha, Dr. Fatma and myself from Canada, at night we go through the patient's details and make sure appropriate patient is selected, because there are some cases that you can't treat. If the patient's volume or tumor is too large, then this machine is not very good for them because of unacceptable dose to the surrounding tissues. So once the patient is discussed and we agree that it's a suitable patient, we then discuss the images with Dr. Khaled and Shayan and make sure if there further images are needed, we go and do those images. Once that is done, then we do our own CT scan, we fuse the outside images if possible, and contour or target the area that we want to treat and target what we want to avoid. Quality, how we make sure that we are up to international mark. First thing, we have decided from day one that patient would be first, no matter what. Patient would be treated as you would like your family member to be treated. So far, patients have spoken highly about how they are treated, and recently a patient sent me an email about how good he felt the atmosphere was. So we make sure the patient comes first. Nobody would be rude to them, and we will explain if we can't treat them the reasons and logistics behind it. This is very important. I can't emphasize enough that just because we can do it, we take all the patients. We shouldn't. We only should treat what we feel